Imagine a storm raging within while the surface remains deceptively calm. This is the reality for many living with quiet BPD. Unlike expressive BPD, quiet BPD is masked by introversion. Intense emotions are directed inward, often unnoticed. This can delay diagnosis and understanding. Individuals may be mislabeled as shy or moody. Understanding quiet BPD helps provide support. Seeking help is a sign of strength. Borderline personality disorder, or BPD, is a complex mental health condition characterized by instability in relationships, self-image, and emotions. Those with BPD often experience intense fear of abandonment. This fear can lead to frantic efforts to avoid separation. The instability in self-image can leave individuals feeling chronically empty and unsure of their identity. Emotional dysregulation involves experiencing emotions with heightened intensity. This can result in rapid mood swings. These intense emotions can lead to impulsive behaviors. Relationships can be particularly challenging. They may idealize others quickly, only to devalue them just as rapidly. This black and white thinking creates unstable relational dynamics. Individuals with BPD may struggle with anger management. This can manifest as verbal outbursts or self-directed anger. BPD is a spectrum disorder with varying degrees of severity. Some may experience mild symptoms, while others struggle with severe symptoms. Each individual's experience with BPD is unique. While all forms of BPD share core characteristics, quiet BPD distinguishes itself by the way these struggles manifest. Instead of outward displays of anger, individuals with quiet BPD internalize their distress. This can make quiet BPD particularly challenging to recognize. They may crave closeness but fear rejection, leading to avoidance and submissive behaviors. This fear of abandonment stems from a deep-seated sense of vulnerability. Despite their desire for connection, they often feel unseen and misunderstood. A defining characteristic of BPD is emotional dysregulation. Imagine a roller coaster with its sudden drops and sharp turns, extreme joy one moment, deep despair the next. These shifts can be triggered by insignificant events. It's like having the volume turned up on their emotional experience. Therapies like DBT help manage these intense emotions, aiding in navigating their emotional landscape with stability. Imagine living with a constant fear of being left behind. This is the reality for individuals with BPD, where the fear of abandonment looms large. This fear can drive their actions and behaviors. It can manifest in various ways. Some may become overly clingy, seeking constant reassurance. They might call or text incessantly. This behavior stems from a desperate attempt to prevent abandonment. Imagine looking in the mirror and not recognizing the person staring back. This sense of disconnection from oneself, of lacking a stable and cohesive identity, is a common struggle for individuals with BPD. They may experience a fluctuating sense of self, their values, beliefs, and even their perception of their appearance shifting dramatically depending on the situation or the people they are with. This instability in self-image can leave individuals with BPD feeling lost, empty, and unsure of who they truly are. They may try on different personas, adopting the characteristics of those they admire or seeking validation from others to define themselves. This chameleon-like behavior, while often mistaken for inauthenticity, is a reflection of their struggle to solidify a core sense of self. This lack of a stable identity can extend to their goals, aspirations, and values. They may experience sudden and dramatic shifts in their career aspirations, personal interests, or even their moral compass. This can make it challenging to make long-term plans or commit to a particular path, as their sense of self and what they want out of life can change rapidly. This instability in self-image can be incredibly distressing, leading to feelings of emptiness, worthlessness, and a profound sense of not belonging. It can also create challenges in relationships, as their shifting sense of self can make it difficult for others to truly know and connect with them. Imagine feeling overwhelmed by a tidal wave of emotions, desperately seeking an escape, a way to numb the pain or regain a sense of control. This is the driving force behind the impulsive behaviors often exhibited by individuals with BPD. These behaviors, while often perceived as reckless or self-destructive, are a way to cope with the intense emotional pain and instability that characterize the condition. Impulsivity in BPD can manifest in various forms. Some individuals may engage in risky sexual behavior, substance abuse, or reckless spending as a way to escape their emotional turmoil. These behaviors provide a temporary reprieve, a fleeting sense of relief from the overwhelming intensity of their emotions. Others may engage in self-harming behaviors such as cutting, burning, or hitting themselves as a way to manage their emotional pain. While seemingly counterintuitive, self-harm can provide a temporary sense of control, a way to translate their emotional pain into something physical and tangible. It can also serve as a way to release pent-up tension or punish themselves for their perceived flaws and shortcomings. These impulsive behaviors, while providing temporary relief, often exacerbate the challenges faced by individuals with BPD. They can lead to relationship problems, financial difficulties, legal issues, and physical health complications, further compounding their struggles. The submerged struggle internalizing BPD. Quiet BPD often remains hidden from view, submerged beneath a seemingly calm surface. Unlike the more outwardly expressive form, individuals with quiet BPD internalize their turmoil. This makes it challenging for others to recognize their struggles. Imagine a pressure cooker, where emotions build beneath a sealed lid. This analogy captures the experience of quiet BPD. They grapple with intense fear of abandonment and emotional dysregulation. Instead of explosive anger, they may withdraw socially or engage in self-criticism. They may appear stoic, leading others to misinterpret their struggles. Dependency and avoidance, a relational tightrope. Relationships present a unique challenge for individuals with quiet BPD. They often find themselves walking a tightrope between dependency and avoidance, torn between their deep-seated longing for connection and their paralyzing fear of rejection. This internal conflict can create a turbulent and confusing dynamic in their interpersonal relationships. On the one hand, individuals with quiet BPD crave intimacy and closeness. They long to feel seen, understood, and accepted for who they are. However, their fear of abandonment is so profound that they may go to great lengths to avoid any potential threat to their relationships, even if it means suppressing their own needs and desires. This fear of rejection can lead to a pattern of people-pleasing and submissive behaviors. They may prioritize the needs and happiness of others above their own, constantly seeking validation and reassurance to maintain a sense of security in their relationships. This can create an unhealthy power dynamic, where they feel perpetually off balance, their sense of self-worth contingent upon the approval of others. On the other hand, the fear of rejection can also manifest as avoidance. Individuals with quiet BPD may withdraw from relationships or sabotage connections before they experience the pain of abandonment. They may erect emotional walls, push others away, or create conflict as a way to manage their intense fear of intimacy and vulnerability. Vulnerability and powerlessness, a constant undercurrent. A pervasive sense of vulnerability and powerlessness often underpins the experiences of individuals with quiet BPD. They may carry a deep-seated belief that they are inherently flawed, unworthy of love, and incapable of handling life's challenges independently. This core belief can shape their perceptions, interactions, and sense of self. This feeling of vulnerability can stem from early childhood experiences of trauma, neglect, or emotional invalidation. When their emotional needs were not consistently met or their feelings were dismissed or criticized, they may have internalized the message that they are too much, too sensitive, or not good enough. This sense of powerlessness can manifest in various ways. Individuals with quiet BPD may struggle with assertiveness, finding it difficult to express their needs or set boundaries in relationships. They may be overly self-critical, constantly second-guessing themselves and their decisions. They may also be hypersensitive to criticism or rejection, interpreting even neutral feedback as a personal attack. This constant undercurrent of vulnerability can make it challenging for individuals with quiet BPD to feel safe and secure in the world. They may go to great lengths to avoid situations or relationships that could trigger their fear of rejection or abandonment, limiting their opportunities for growth, connection, and fulfillment. Quiet BPD and depression often go hand in hand. The internalized pain and difficulty maintaining relationships can create fertile ground for depression. Individuals with quiet BPD may experience intense sadness, hopelessness, and loss of interest in activities. They may withdraw socially, struggle with low energy, and experience changes in sleep or appetite. The internalized anger and self-criticism can further fuel depressive symptoms. Seeking professional help is crucial for managing symptoms and improving quality of life. Quiet BPD is a complex condition with roots in both biological vulnerability and environmental influences. Imagine a balance scale with genetics and environment. When disrupted, it can increase the likelihood of quiet BPD. Research suggests individuals with quiet BPD may have a genetic predisposition towards emotional sensitivity and difficulty regulating emotions. Environmental factors, particularly during childhood, play a crucial role in shaping these genetic predispositions. Early trauma or neglect can disrupt healthy emotional development, leaving individuals more susceptible to developing quiet BPD. Understanding these factors is crucial for developing effective treatment approaches. Childhood trauma casts a long shadow, often reverberating throughout an individual's life. For those with quiet BPD, early trauma can significantly increase the risk of developing this disorder. Traumatic experiences during childhood can leave lasting imprints on the developing brain. Trauma can take many forms, from abuse to neglect, and can be particularly damaging for a developing child. These adaptations can have long-term consequences, making it challenging to form secure attachments and regulate emotions. Therapy can provide a safe space to process these experiences and develop healthier coping mechanisms. Brain development and function, a biological perspective. Research suggests that certain areas of the brain may be wired differently in individuals with quiet BPD. The amygdala, the brain's fear center, may be hyperactive, reacting more strongly to perceived threats. This heightened reactivity can contribute to the intense fear of abandonment and emotional volatility. The prefrontal cortex, responsible for higher-level cognitive functions, may be less active, making it challenging to regulate emotions. With therapy and support, individuals can learn strategies to manage their emotions and improve impulse control. Chemical imbalances, the role of neurotransmitters. Imbalances in neurotransmitters like serotonin and dopamine may contribute to the emotional instability in quiet BPD. Serotonin plays a crucial role in regulating mood, sleep, and impulse control. Lower levels of serotonin can contribute to feelings of sadness and difficulty managing impulses. Dopamine is involved in reward and motivation, and its dysregulation can lead to emotional highs and lows. While medication can help, therapy remains the cornerstone of treatment. The hidden prevalence unmasking quiet BPD. Determining the true prevalence of quiet BPD is challenging due to its lack of distinct diagnostic code. The subtle and internalized nature of quiet BPD makes it difficult to identify and track its prevalence. Individuals with this subtype may not exhibit the same outward signs of distress, leading to underdiagnosis. Research suggests that quiet BPD may be more common than previously thought. Accurate data on the prevalence of quiet BPD is crucial for informing public health initiatives and ensuring appropriate diagnosis and treatment. Gender and quiet BPD, challenging assumptions. Recent research challenges the assumption that BPD primarily affects women. Emerging evidence suggests that men may experience BPD, including the quiet subtype, at similar rates as women. Men may internalize their distress, masking their struggles behind a facade of stoicism or substance abuse. This tendency to mask emotions can make it challenging to recognize quiet BPD in men. Healthcare providers must approach diagnosis with a gender-sensitive lens to ensure appropriate care and support. The diagnostic maze, navigating the complexities of quiet BPD. Diagnosing quiet BPD can feel like navigating a complex maze due to its subtle presentation. Unlike more overt forms of BPD, quiet BPD often hides in plain sight. Individuals with quiet BPD may camouflage their struggles, leading to misdiagnoses. The symptoms of quiet BPD can overlap with other mental health conditions, making accurate diagnosis crucial. A comprehensive assessment is paramount for identifying the underlying drivers of distress. Beyond the label. The importance of individualized assessment. A diagnosis of quiet BPD provides a framework for understanding struggles, but doesn't fully encapsulate the individual's journey. An individualized assessment goes beyond checking off symptoms from a list. It involves exploring an individual's unique history, relationship patterns, and coping mechanisms. This approach acknowledges that no two individuals experience quiet BPD in the same way. By embracing this diversity, we can create a more compassionate and effective approach to mental health care. Recognizing the storm clouds, identifying your personal triggers. Living with quiet BPD can feel like navigating a world fraught with emotional landmines. Understanding your personal triggers is crucial for managing your condition. Triggers can be external, stemming from events or interactions, or internal, originating from thoughts or memories. Identifying your triggers requires honesty and compassion. This self-awareness is the first step towards reclaiming your power and navigating your emotional landscape with greater skill. Relationship turmoil. Navigating the minefield of connection. Relationships often lie at the heart of quiet BPD, serving as both a source of deep longing and a potential minefield of emotional triggers. The intense fear of abandonment, coupled with the deep-seated desire for connection, can create a turbulent and confusing dynamic. Imagine a dance floor where one partner is constantly afraid of being stepped on. This captures the often uneasy balance in relationships where quiet BPD is present. The fear of rejection can lead to people-pleasing and difficulty asserting one's needs. Common triggers include perceived slights, changes in behavior, and conflicts. Even positive events can trigger anxiety and insecurity. Navigating these challenges requires open and honest communication. Sharing fears and vulnerabilities can foster understanding. Setting healthy boundaries and developing coping mechanisms are essential. Loss and rejection. Weathering the storms of separation. Loss and rejection can trigger intense emotional storms, threatening self-worth and stability. Fear of abandonment resurfaces, leaving you overwhelmed and alone. Imagine a ship caught in a sudden squall, its sails ripped, its hull tossed about by waves. This captures the feeling of being buffeted by intense emotions. Events like breakups or job loss can trigger sadness, grief, and loneliness. Coping requires patience, self-compassion, and support. Engage in self-care activities that bring comfort and solace. Connect with trusted friends, family, or a therapist for support. Section 4. Intrusive thoughts, calming the inner tempest. Imagine a calm lake suddenly disturbed by a barrage of rocks, its surface no longer a mirror, but a chaotic dance of ripples and waves. Intrusive thoughts are unwanted and distressing, often surfacing during stress or anxiety. For those with quiet BPD, these thoughts can be about abandonment, rejection, or self-harm. Remember, having these thoughts doesn't define you. They come and go. Mindfulness and deep breathing can help you observe these thoughts without judgment. If persistent, seek professional help to develop effective coping strategies. Effective treatments for quiet BPD. Living with quiet BPD can feel like navigating intense emotions and relationship challenges, but there's hope. Effective treatments can help manage symptoms and build a fulfilling life. Recovery is about learning to navigate challenges with skill and resilience. Imagine a lighthouse guiding a ship. Treatment provides direction and safety. Therapy, especially DBT, is the gold standard for treating quiet BPD. DBT offers skills for managing emotions and improving relationships. Medication can help with co-occurring conditions like anxiety or depression. Remember, recovery is a journey of growth and self-discovery. Therapy provides a safe, supportive space to explore challenges, develop healthier coping mechanisms, and build a fulfilling life. It's a collaborative journey of self-discovery and healing, guided by a trained professional. Imagine a gardener tending to a delicate plant, providing the right amount of sunlight, water, and nutrients to help it thrive. Different therapeutic approaches can be effective in treating quiet BPD. DBT teaches skills for managing emotions, reducing impulsive behaviors, and improving relationships. CBT helps identify and challenge negative thought patterns. Finding the right therapist is crucial for a successful therapeutic experience. Section 3. Medication. Finding relief from co-occurring symptoms. Medications can help manage co-occurring conditions like anxiety and depression, making therapy more effective. They act as a bridge, providing stability while you build healthier coping mechanisms. Medication is most effective when combined with therapy. Consult a psychiatrist to determine the right medication and follow their guidance carefully. Section 4. Reaching out. Recognizing when to seek professional help. Recognizing when to seek professional help for quiet BPD is a crucial step towards healing. Certain signs and symptoms warrant reaching out to a mental health professional. Remember, you don't have to navigate these challenges alone. Seeking help is a sign of strength, not weakness. Imagine a hiker lost in the woods. They can use a map or guide to find safety. Similarly, seeking professional help provides tools and support to navigate challenging emotions. Quiet BPD is treatable, and with the right support, you can live a fulfilling life. Quiet BPD does not define you. Living with quiet BPD can feel like carrying a hidden weight, a silent struggle. It's easy to feel defined by the challenges, but remember the quiet strength within you. Quiet BPD is just one aspect of who you are. It doesn't define your worth or potential. Like a diamond formed under pressure, your experiences shape your resilience. Embrace your strength with self-compassion and kindness. You are capable of creating a fulfilling and meaningful life. Treat yourself with the same kindness you would offer a dear friend. Acknowledge your pain without judgment. Never give up hope. A brighter future awaits. You are not alone. Living with quiet BPD can feel isolating, like carrying a silent burden. But remember, you are not alone. Many share similar experiences and can offer empathy and support. Sharing your stories creates a symphony of shared experience, breaking down isolation. Seek professional help, join support groups, or connect online. Your story deserves to be heard. Reach out, connect, and find strength in shared experiences.